Thank you, Joanne, and thank you all for coming out here today. I am State Representative Kathleen Clyde, and I want to thank Protect Your Care as well. This national organization began several years ago to educate Americans about the need for reform in our healthcare system. While state and federal legislators are home in their districts this month, people like myself and the women with me here today will be helping Ohioans know the truth about Obamacare. Stephanie, Jenny, and I are here today to talk specifically about the Affordable Care Act and women's health. Unlike the Ohio GOP and Republicans in Congress, this law takes women into account. Consider just a few features of Obamacare that Republicans aren't talking about. Since 2011, nearly 27 million American women with private health insurance have gained preventative services with no cost sharing. These standard services include mammograms, cervical cancer screenings, prenatal care, and regular well baby and well child visits. Since just the beginning of this month, many health plans now cover well women visits, gestational diabetes screening, domestic violence screening, breastfeeding supplies, and contraceptive services. At least 1 million women ages 19 to 25, previously who were uninsured, have been able to get coverage through their parents' health insurance. Beginning next year, insurance companies will no longer be able to charge higher rates to women due to gender or health issues. In 2014, nearly 19 million women in America will have new opportunities for health coverage through the health insurance marketplace in their state. In 2014, insurers will no longer be able to charge more or deny coverage to anyone due to a pre-existing condition. The Department of Health and Human Services estimates that there are more than 5 million non-elderly Ohioans who have some type of pre-existing condition such as asthma or diabetes. Here's something also that Republicans aren't talking about in their meaningless repeal efforts. Health insurance companies now have to spend at least 80 cents of your premium dollar on actual health care or give their customers a refund. Those are just a few of the highlights of the Affordable Care Act. One would think that our elected representatives in Congress, such as Representative Steve Stivers or Rep. Pat T. here in Central Ohio, would be providing constituent services around this law, helping families and businesses understand how it works and how to engage with the system. One would think that our statewide elected leaders and legislative leaders would be putting their shoulders to the wheel to make health care reform work for Ohioans. Unfortunately, we know that that's not the case. Carrying the water for big business interests and extremists, Stivers, T-Berry, and congressional Republicans have voted 40 times to repeal Obamacare, casting votes they know are meaningless, wasting the public's time with these efforts rather than providing constituent service. Governor John Kasich, Lieutenant Governor Mary Taylor, and legislative Republicans have turned Ohio into ground zero in the right wing's war on women, and their efforts to put roadblocks in front of health care reform are front and center. Governor Kasich refused to exercise the state's right to run its own health insurance marketplace, and through a variety of actions and lack of action, Lieutenant Governor Mary Taylor has used her position at the Department of Insurance to thwart health care reform. In our state legislature, legislative leaders have killed Ohio's opportunity to expand Medicaid. We all know the details. The federal government would pay to get the expansion off the ground and pick up 90% of the cost thereafter, providing more than 250,000 Ohioans health insurance that they currently cannot afford. We are here today to say enough is enough. If there are improvements to be made to Obamacare, Democrats at the state and federal level are ready to discuss that and improve the law. With so many good things in the law for consumers, repeal is not an option. Repeal is not even politically viable. What Ohioans are getting from the GOP is cynicism, lies, and obnoxious politics. So I pledge to work with my legislative Democrats to work to educate Ohioans about the good measures in this law and fight these continued efforts to repeal an important law for women's health in the state of Ohio. I'd now like to turn the microphone over to Stephanie Kight, President and CEO of Planned Parenthood Ohio, for more about women's health care and the opportunities that many Ohioans are missing due to these dysfunctional politics.